Welcome back to my channel. Today we will discuss about acute chest pain differential diagnosis. What are the differentials for acute chest pain that you know? Either it can be a pulmonary embolism or else can be stable angina, acute coronary syndrome, aortic dissection, pneumothorax, pneumonia or pericarditis. So key features of these acute chest pain conditions is a must-know thing when you prepare for your exam purposes, and there are some other conditions that cause acute chest pain as well. Other less fatal conditions are gastroesophageal reflux disease or anxiety, or either it can be a cause of musculoskeletal pain. We'll discuss these one by one. Pulmonary embolism. So as you can see in this diagram, emboli, either thromboembolism or fat embolism or any kind of embolism, goes and stuck in the pulmonary vasculature. Therefore, you can elicit some signs and symptoms and come to a diagnosis, yes, that this is a case of pulmonary embolism. So, what are those symptoms and signs? Symptoms include dyspnea, pleuritic type chest pain, or else retrosternal chest pain, and also cough and hemoptysis can be there. And in severe cases, right heart failure can cause us dizziness or syncope. So these are the symptoms, major symptoms that you should keep in mind for pulmonary embolism. And there are some signs that you can elicit for pulmonary embolism. So what are the signs you can elicit in a patient with pulmonary embolism? First, there can be tachypnea or tachycardia, and the patient can be hypoxic. Pyrexia can be there, and the JVP is usually elevated, and you can find there's a gallop heart rhythm and a pleural rub, and also systemic hypotension and cardiogenic shock can also be there. So there's a scoring system that you should keep in mind for pulmonary embolism, that's the Wells score, and if the Wells score is more than 4, pulmonary embolism is most likely. So we'll discuss about these features more in a separate video about pulmonary embolism. Stable angina is another differential diagnosis that can bring about acute chest pain, and here the chest pain brought on by exercise and resolves once at rest. Now we'll discuss about acute coronary syndrome, and I did a revision guide about acute coronary syndrome before, and please look at it as well. And acute coronary syndrome, there's usually chest pain lasts about more than 10 minutes, and the pain starts with minimal activity or can start while at rest, and it usually radiates to left arm and left angle of the jaw. So the patient usually complains about that there's a retrosternal pressure or tightness or constricting type pain, and usually systemic features like sweating, nausea and vomit also can be there. And another important thing is patient can having shortness of breath, and that's about acute coronary syndrome. Another differential for acute chest pain is aortic dissection, and keep in mind the conditions that I talked about are acute medical emergencies, and aortic dissection is also such an emergency, and usually there's a sudden tearing type chest pain, and it usually radiates to the back between the scapula. That's how the patient usually explains you about his pain. And nausea and vomiting can be there. Patient can be hypertensive and tachycardic. And in a patient you suspect of aortic dissection, make sure that you measure the blood pressure of bilateral arms, because there can be a pressure difference. And the pulses can be abnormal or absent. Now we'll discuss about another condition, that is pneumonia. Pneumonia, usually there's a history about 3 to 4 days of purulent sputum. Patient can be having fever, cough. So that's about pneumonia. Pericarditis, that's inflammation of the pericardium. Usually a sharp pain is there and relieved by sitting forward, and patient can have fever and cough. So here the pain is similar to that of angina, but keep in mind that in pericarditis the pain changes with body position. So that's how a patient explained to you. So these all are life-threatening conditions, and another non-fatal condition is esophageal reflux disease. Usually there's a burning pain and acidity that can be tasted in mouth, and it can associated with ingestion, and usually patient complains that he's getting pain when in supine position. That's about gastroesophageal reflux disease. Other conditions that I mentioned in previous differential diagnosis are anxiety and musculoskeletal pain. So these can mimic acute chest pain too. So it's very important you to identify what are the emergencies, what are the life-threatening emergencies and normal conditions, and treat them accordingly. So this is about acute chest pain differentials. I hope this revision guide is useful to you. So don't forget to like and share with your friends, and don't forget to subscribe our YouTube channel for more revision guides like this.